And the topic that I chose today was, how does a surgeon find calm in the storm? As I have mentioned earlier, it's a personal take on my personal journey. So if I do sound preachy, please forgive me. It is not because I want to preach to anyone. It is just a reminder to myself from the lessons that I have learned from my own life. And my entire intention of this talk is to improve the health of each one of us in this room, the healthcare providers. It is very saddening to know that the longevity of a healthcare provider is less than the normal citizen. It is also saddening to realize that we suffer far more with emotional anxiety and depression and confusion than an average citizen. It is also saddening to know that we fall prey to poor lifestyle, long working hours, much more than any other community. So to the 15 lakh doctors in this country, this is my take. Let's begin with a case. Sometime back, a 35-year-old gentleman, well-known event manager in our city, somebody who would sit with the biggest people in the city. He had a poor lifestyle, obviously, because he was an event manager. He used to take people out for destination weddings, anniversaries, birthday parties, not only in India but abroad. And this gentleman came with a pain, right iliac fossa, and fever for last 10 days. He had been advised to get admitted, but he was not getting admitted because he was so busy in his work. He had hypothyroidism, but he had untreated gout and untreated polycythemia for the last 4 years. And then we did a CT scan and he had a right iliac fossa phlegmon and a ruptured appendicitis. This is what we did. We optimized him and got him in the OR. And this is the the omentum wrapping that we frequently would see. That's the dilated ileum. And you see all that dirty pus out there. You can find that the gangrenous appendix is taking a peek at you. And then we try to go back into the basics, which is understanding, go from the normal anatomy to the non-known territory. So we are going lateral and peeling the cecum and the appendix off from the lateral peritoneum, where we would get less chances of damaging anything. So that's what we are doing. And then realizing that the harmonic might not be the best hemostat here, we try to use bipolar and then combine it with the harmonic scalpel. And then moving forward, trying to identify the normal bowel, that's the cecum. So once you identify that, having a gauge piece at the bottom, making sure that you are not injuring the ureter, we're not injuring anything posteriorly. We find a safe place at some point, you find a perforation at the base, so obviously the cecum has to be taken care of. Now there are options here. You could do ileocecal resection, you could do, if you find a base is healthy, you can fire a stapler, suture it, whatever. So here we fired a stapler at the base of the appendix. And this is a purple staple line. So it's a fairly large staple line. Now after that we washed it and we put in drains and then we came out. So that was the surgery that we did for this patient. 4 hours after the surgery, the patient became restless. He became breathless. The arterial blood gas showed that the PO2 level were falling, carbon dioxide levels were rising, hemoglobin was 9 from 16. The drain was showing 50 ml dark blood, but no more. The post-operative bedside USG showed a huge collection in the abdomen, and we diagnosed this must be a hemorrhage. It could be either reactionary or it could be because of an impending DIC. Both were in the mind. We took this patient inside the OR after counseling, and we did open re-exploration because this was 12 o'clock in the night. I didn't want to do this laparoscopically again. The patient was now on a ventilator, now was hemodynamically unstable. We just stabilized him and took him with a lower midline incision. There was a diffuse ooze at the ileocecal bed, but no active bleeder, which is possible. And there were about 1.5 liters of collection, bloody collection drain, but no clots. So we packed the area with Surgicel, we closed the abdomen, and we put this patient on ventilation back, explained to the family that this is a patient, could be a reaction hemorrhage, but it's possible this is a DIC, early DIC, and we have to be careful. We changed the antibiotics, and we got the hemato and the ICU expert on board. He did well till about 48 hours, and we extubated him at 48 hours. There was, however, the kidneys were shutting down. The urine kept on dropping till it was 0. at 48 hours. So when we extubated him, he had no urine. And we got the hematologist and nephrologist on board. The nephrologist put him on a sled, and the hematologist said that because of the untreated polycythemia, let's give him injection ROMI, which is basically something which stimulates the bone marrow to produce platelets. On day 7, there was rising. He became better with the hematology, and the DIC profile improved over the next 4-5 days. But he started showing rising bilirubin and enzymes. The bilirubin went to about 8. And there was rising amylase lipase levels, which showed that he has also got acute liver injury and acute pancreatitis. We got the gastro on board, and they managed him conservatively for these two things. On day 11, we found that on the CT, we did about 3 CTs in 11 days just to check if everything is all right. The CT showed a collection of about 50 to 80 ml in the right iliac fossa, which the radiologist drained with a catheter. On day 17, this guy, over a period of time with multidisciplinary approach, became stable. He tolerated oral soft diet. He was passing stool. He wasn't having any fever. The check CT showed no collection, and the urine output picked up to about 70 to 100 ml per hour. The creatinine came back from 7 to 8 to about 3 to 4 and was in the declining phase. However, the total leukocyte count remained at 30,000 despite the antifungals that we had fired. And now we told the family that, otherwise it looks good. But his count suggests it could be resistant bugs. We'll do check CTs to see any collection, which did not show anything at that time. And at that time, the family decided to transfer the patient to another hospital in another city. On day 22, they found that the patient was having a hematuria, a bloody urine. And they did either a cystoscopy or a supracath, one of the two, I'm not sure. And post that, the patient had pain. And then they had a CT scan done and found that the collection was there in the pelvis and in the right iliac fossa. They decided to reoperate the patient after counseling the patient and said that, we should do a definitive surgery for this guy, do the ileocecal resection, and put in a stoma. That's what they did. But the patient never recovered from the multiple organ failure, and the patient died. The aftermath was that the patient's family was told that something went wrong in the primary surgery, and there was probably an undiagnosed leak, and the doctors in the second hospital said so to the patient's family. The family launched a social media offensive, huge, on the Facebook. And they called up a lot of friends, my friends, mutual friends. These are very, very popular people. And they called up the hospital CEO to take action against me. They complained in the medical council. They filed a case in the consumer forum. Obviously, at that time, when all of this happens together from a very prominent person firing everything in the print media, in the social media, the first thing that happens is your OT gets cancelled. Your practice dips. Some people say, you know what, I will choose another surgeon in another hospital. People, I'm a very social guy. I go to a lot of parties, and there people, some of them stop talking to me. Some people would look suspiciously at me. Some people who are a little more polite, they would say, what happened? What really happened? What went wrong? What did you do wrong? And some actually said, let's not talk about it. It's okay. But some of them, of course, were very good, and they stood up for me and saying, there's nothing wrong in a poor outcome. A poor outcome doesn't mean negligence, but that's just far and few in number. My response was that I had to go to the friends and colleagues and seniors and lawyers and ask them how to combat this situation. I'm not aware of how to do this. For the first time I'm facing this. What do I do? I'm a lot of years in this practice, but I don't know how to neutralize this. Some said, stay low, don't do anything. Some said, invite the alleging family for a discussion outside the court and talk to them. Give them the evidence, give them the OT videos and all that. And some said, why don't you file a case for malreputation? And I can tell you at this point, my mind was like this. My mental status was, I was worried. I was worried as to what is happening to me. I also felt cheated because I thought that I had put in everything as a reasonable clinician with my inputs would do, and I did not think at any point of time during the time that the patient was there in my hospital that I was doing anything unreasonable. I had a board of doctors with me who were all eminent, all very, very good clinicians. So I felt cheated. And I also felt demotivated. If this is what is going to happen to us after years of practice with one patient's poor outcome, the blame coming to us, I was very demotivated and also felt insecure. Is my practice ever going to pick up? Am I going to reach the same height that I was there again? Is my practice going to go down completely? So I felt very insecure. I looked at my colleagues and thought, okay, this guy is going to go ahead of me now. You know, I had those insecurities. Coming back to the question, how does a surgeon find calm in the storm? The storms in the surgical practice, as Dr. Suryavanshi said just before me, this is not the only storm in your life. Getting mistrust from the patient or patient's family, getting litigated, this is not the only storm. Your other storms are the increasing expectations from your patient. You have said, okay, you have a painful hernia surgery, I'm going to make it painless. You have risen the expectation of the patient. You want to open fistula surgery, I will do it by laser. You have raised the expectations of surgery. You have put in hoardings. And this is not sometimes because of us, but because of the collective responsibility of the society, the doctors, the entire print media, and the market players. So we have raised the expectations of the patient, where poor outcomes means negligence. Our fees have reduced. At the end of the day, I need money. I need money to fend for my family. My children have education. That costs money. I have installments to pay. On the one side, I'm expected to carry a mobile phone, which is of great, company, and also a good car, but my fees are reducing. In the hospital, everywhere, something is going wrong. That's increasing our pressure to do more to earn the same amount of money. There's increasing paperwork. If you look at the corporate hospital doctors like me, I'm spending about 20% of my time in just doing paperwork, a lot of paperwork, to make sure that when these cases go to the court, I have my back covered. There's a lot of competition. Every year we put in thousands of surgeons into the system, and these thousands of surgeons in the system are coming with the expectation that they will get a space and take the pie from all of us. But the pie is not increasing. What we are doing is just putting in a lot of numbers inside the system without caring what they're going to do. I'm very disheartened when I see a great surgeon coming out 10 years after their practice and getting into an RMO and getting 70,000 rupees a month salary from my hospital. Why should a 10-year-old educated trained surgeon get 70,000 as an RMO in a hospital? Why can't they have more? And finally, corporate hospitals have brought in with themselves their own challenges. It's about the numbers. It's about beating the bank. It's about things that we don't understand as doctors. I don't. And finally, there is a pressure of learning new things. You'd say today, I can do anal fistula surgery. Somebody will say, do you know waft? Do you know lift? If you say, I can do an eye pump, somebody say, do you know ETAP and do you know TARM? If somebody is doing a good TAPP, they'll say, do you do it robotically? We have brought this problem to ourselves, where the pressure of learning new things have become more important than delivering the care to the patient. If I told you a Liechtenstein and a TEP and a TAPP and an ETAP and a robotic groin hernia surgery leads to the same result, it does. And still we are here to believe that the robotic TAPP is better. And we are going to follow the trend, because it's a trend, it's not evidence. The usual reaction by surgeons when you face a storm is this, what I faced. You feel anxious, you feel worried. You make an effort to neutralize this challenge by acquiring more power, because you think, this guy is nailing me, I can nail him back if I have more power. And how do you get that power? You can get that power by becoming the president of an association, by becoming a secretary of an association, by being close to politicians in your community. You can do so many things. And that's what we generally do. But this exactly is the opposite of what authentic, genuine strength of a surgeon is, which is acquiring authentic knowledge by reading your books, by learning from your patients, and just delivering patient care. We did not sign up for getting more power, the external power. I'm here to not preach, but just propose to you an alternate way to respond to these storms. Just consider it. You may reject it at the end of the lecture, but You can consider it. And I'm telling you, the alternate way to respond to all these storms, only professional here, but you can use it in your personal life, is the calmness. As I told you, whatever I told you about myself was my mind's reaction. But there's something called the spirit inside us. You may choose to believe it. You can call it scientifically the subconscious mind. You can call it religiously your soul. And if you are very theological, you can call it God. But whatever, you have a spirit in you. And if you live by your spirit, you will know how to respond. Which brings me to this idea that each one of us is a body, which you see in the mirror. You know about your mind because that's the mind which is listening to me right now. It's here in this room. But then if I leave you, your mind will go here and there. But there's another area, another invisible part of you, which I believe is the spirit. And I'm here to convince you with this. This is the busiest slide, and I just don't know how to present this to you. I am saying this to you, that there is an invisible part in you, but there are two of them. One is your mind. The other one is your spirit. And the difference between the two is like this. The mind is the one which is the monkey, which is going from here and there and there and there, never staying there. When you wake up, you have barrages of thoughts. That's your mind working. The spirit is the calm one. When you sit quietly at some place and looking at a sunset or a sunrise and you have no other thoughts, that's the spirit. The mind is reactive, irritable, even angry. In the operating theater, when you find your cameraman is not showing you well, hey, "Theek se dikha, what are you doing?" That's your mind. That's your mind. Whereas if you were working through your spirit, you would say, "Are you having any problem by showing this? Can I help you?" That's your spirit. That's your spirit. If your mind will, if you notice, it is always in the past, either telling you, you didn't do this well, or it will tell you, in the future, you will get into the same problem. So it's either in the past or in the future. However, your spirit will focus on the work that you're doing now. So if you're in the OPD, and if you're talking to your patient, and you're listening to the history of the patient, if your mind is thinking about, I have to go in the night to this place, I have to prepare my lecture, that's your mind. But if you're saying, I must listen to this man attentively, all of that he's saying is going to make an importance to my writing the prescription. That's your spirit. The mind would like to show off. You give me a presentation, I like to show off with showing you amazing surgeries. That's my mind. I want to show off. But my spirit is the one which wants to tell you, you don't need so much of knowledge to practice science. You just need intuitive, authentic knowledge. Learn from people who have done good work. Get under them, train yourself, read your books. That's your intuitive, authentic knowledge. Your mind has got an ego, which means I am special. I am special. Then it becomes insecure. So I became insecure because of one patient's reaction to me. Whereas if I was to work with my spirit, I would be peaceful. Nothing that you tell me is going to harm me. It's your impression of me. It's your opinion. And there would be a quiet confidence if you work through your spirit. You would not get disturbed by what people think of you. If you are in your mind mode, you will be competitive. Every year, every day, you want to do something that makes you feel enough. To be happy through your mind, you will need to do a lot. You will need to make hospitals. You will need to be a president of a association. You have to buy a big cars. You have to have a lot of patients. You need to do 10 surgeries a day. Because your mind will not allow you to be happy with less. Whereas if you are with your spirit, you will not be competitive. You will know that each one of us is special. If there's somebody special in this room, each one of us. If there is nobody, everybody is unique, then there's no competition. Your spirit is identical to my spirit. There cannot be any difference in our spirit. There's a difference in our body. There's a difference in our mind. But what difference is there in our spirit when we were born? There's no difference. We're all equals. So there's no question of being jealous. I have experienced jealousy to an extent that I would think, why doesn't this guy, just disappear from the hospital? You can have that kind of intense emotion. There's no shame in acknowledging it. As long as you know that there is a mind which is jealous, you will be able to neutralize it. But if you're not aware, you will never be able to neutralize it. You will not be able to live through your spirit. The mind works with the fear of missing out. Every now and then people want to invite you to a meeting, to a talk, to some group discussion, and 2 Facebooks and 2 WhatsApps, and you don't want to miss it because you have a fear that you're going to miss out on something important. But if you had authentic knowledge and you work through your spirit, you would have the courage of missing out. I don't want to know. This is not what is going to translate into any improvement in my clinical practice. It's not going to give value to my life. Save your time. Time is the currency of your life. People want to take it. You have the option of not giving it. Finally, the mind is always attached. It makes you too attached, over-engaged with your career, so much so that you neglect your family and friends. Whereas if you work with your spirit, you become detached and you become more balanced. This is almost like the Matrix movie where you have a red pill and the blue pill. I'm going to offer you. You want to live through your mind? You will be ambitious. You will achieve a lot in this material world. You have a lot of money. You will have a lot of fame. So the mind world is great. And I'm also offering you, live through your spirit. You will weaken your ambition. You will strengthen your spirit. You will lead a far balanced life, a healthier life, a stable family back home. And you will not be competitive at all. You will not have any bone of jealousy in you. And you will feel at peace at all points of time in your life. Now, I'm not saying that I can do that. I'm only telling you it is possible to be in that realm of the spirit. You can work through your mind at certain parts of the day. It is essential. You need ego to work through this life. You need ego. It is essential to be with the mind. But you also need your spirit to have a balanced and a detached life and a joyous life. The question is, if I tell you the spirit life is good and you want to take the blue pill, the question is how? What is the path to reach to the spirit? How do you reach? Go within. Meditate. Meditation is the way to see both your mind and spirit. When you sit quietly, what happens is that if you have sat long hours enough, you can see what your mind does to you. You create your enemies. They're not there actually. You create a career path which is not there actually. You create your own vision of how many things I have to do to be happy. It is not there. It's just the mind. When your mind controls your life, then you are not in the control of your life. And that's what happens to most of us. But let's see if we can change this in this room. I am going to request you with my folded hands to close your eyes, because 80% of your visual stimulus comes from your eyes, your vision. So I would request you to close your eyes and see if we can meditate in this room for 30 seconds. So close your eyes and please focus on your breath. Take a deep breath till a count of 4, hold till 4, and exhale in for 4. So I'll do it and my mic is going to transmit, and then you can do this. Keep doing this while I just ask you. As I said, I'll just ask you to do this for 30 seconds. Now think about who you are while you breathe. Are you the body that you think you see in the mirror? I don't think so, because you were not born like this. Your body was not like this in your youth. You have changed over time. And if I told you scientifically, 10 years back, none of the cells that exist in your body now existed then. So you're not even your body. Are you the mind? But the mind is never in one place. The mind has been always going from one point to another point to another point. The targets have changed. Are you your reputation? You can't be, because some people think you're bad. Some people think you're good. So you're not your reputation either. And I'm saying this now. Maybe, perhaps, you're the spirit that lives within you. That's constant. So you can open your eyes. And now, I'll tell you, if you reach the spirit somehow, this is how the spirit life is. You become detached, you focus on authentic knowledge, you have courage of missing out, and you have a balanced life. In Bhagavad Gita, Krishna says, what belongs to you today belonged to someone yesterday and will be someone else's tomorrow. Change is the law of the universe, which means that whatever you think you're holding on to today, you are a great surgeon, you're number one in your city, it was somebody else's 10 years back. It will be someone else's 20, 30 years later. Don't hold on to it. There's nothing so great about being the best surgeon in your city. Yeah, weaken your ambition. So now I think what I do is I keep on telling myself in the morning, I have a small mirror where I write, I do my job because it's my livelihood. I have to bring in money for my family. It's important to know the reality. And number two, I'll do it because I love it. I like operating people. I like healing people. I like seeing the satisfied faces. I like it when I do things in a clean way. I don't spill blood. I don't have complications. I like it. I like it. I love it. And I don't do it anymore because of the money involved with it, or how much is coming in, or what are you going to tell me, okay, you did a great job, you're a great surgeon, I heard so much about you. I don't care. And lastly, I don't care if the patient is doing well or bad. It's going to sadden me to some extent. I am not tied with this anymore. I'm detached. This is not in my hands. The Spirit also gives me authentic knowledge. It takes me on that path. I now focus on my clinical practice, reading, relearning, and writing. Do you see meetings and conferences here? No. That will come. It's a side effect of what you do. In clinical practice, when I am with the patient, I want to give them my entire, very important, one attribute, that's attention. I want to be at the present. I want to listen to everything they have to say. I was going to operate a patient with a large hernia at the stomal site closure of a patient with pelvic malignancy, and I did a CT scan which came as normal, and I saw it myself, and I said, wait, what is that? And I asked the patient, do you have any vaginal discharge? She says, yeah, foul smelling. And I saw a rectovaginal fistula. I said, I'm not operating this patient. And this was reported as normal on the CT scan. When you pay attention, you see more, you learn more. Patients can teach you more than anyone else. Nothing can beat what patients can tell you. It's clinical practice after all. And in the post-operative round, if you're not doing it yourself, I encourage each one of you, do it yourself. Check the pulse, do the abdomen, do the old school thing. Don't forget the pulse oximeter. You just see the patient yourself. You learn so much. You know when to re-explore. You know if the patient is good or bad. Don't rely on so many juniors that you've kept for yourself. It's not going to work. What is going to work, make you wiser, is your post-operative round. Write notes clearly and in detail. Now, I am saying this, that the Spirit part doesn't mean that I'm going to trust everyone. That also means that I am in the present moment. I am going to write down everything that I have talked, and I'm going to take the signature of the patient's family also if need be, what I'm saying to them. That's what it means. And I like to do something which I call acquire relevant knowledge, which means throughout the day, after working 7 hours or 8 hours, I find that there was something I saw in the afternoon, a patient with a pancreatic SOL, and I didn't understand it well. I am going to talk to a friend who knows it better than me. Or I'm going to look into the paper which talks about this. Or I'm going to listen to a podcast on the pancreatic SOLs and see if it is NETs or not. And lastly, the last half an hour of my day is always data collection. Because if I'm not writing my data, I'm not building my data, what am I going to publish? How am I going to learn? How am I going to audit myself? Reading. If you're not reading, how are you growing? I ask you, how are you growing if you're not reading? No amount of faith with a colleague is going to replace your own reading. You have to read. You have to read books. You have to read journals. You have to read and understand and discuss. If you are not doing relearning, if I did not relearn things, I would not have the first mover advantage. I think one of the reasons why I'm here is because maybe I have relearned a few things and I did that probably ahead of some people. Maybe that's what happened. So I've done on peritoneal flaps. I'm probably ahead on bariatric nutrition. I've been on the robotic platform early and something like facial tracts. So, when you learn new things, you propel yourself. But that's not because I want to show off. It is just because if there's something new, I would like to try it, see if it works in my hand. If it does, then I'm going to share it. all that reading, clinical practice will automatically translate into writing. If you have a lot to share, you will share something which is worthwhile. So in the last 6 years, I've produced 40 papers and about 3 books. I'm not saying again this from a pompous way. I'm just saying this came because of that authentic and genuine knowledge. And I felt like sharing it. And spirit life means that you have a quiet confidence. You have the courage of missing out. You don't let failures or success or malreputation affect you. And you don't let people entice you with posts, with faculty positions, with talks, with your attention, because your attention is your time and your time is the currency of your life. You have to decide for yourself which way you have to go. And finally, the spirit gives you a balanced life. You focus on your health. You don't want to give that time to anyone else. Your health is your body. Your body is housing your mind and your spirit. You want a good body. This is my uncle. For 13 or 14 hours a day he used to work. He came from a village. He was a teacher. And he wanted to work hard for his family of 4 children and his wife and also his extended family. And after 14 hours of work, when he used to come home, he used to go to the kitchen to make something for the children. If you have a stable family, you will have a cleaner spiritual path to deal with your professional life. This man did not need to do this, but he did it. And I'm totally amazed. This is my Saturday friends. None of them are doctors or surgeons. They're all people from different walks of life. But when you have time, you spend on friends, that is what gives you perspective of life from different angles. Hobbies. This is my young son who's dancing. There's no music. We don't have sound being transmitted to you, but he's dancing of Shape of You. And as a child he would do that, and when he grew up, he's now 18, he doesn't dance anymore because he's lost his soft side. There's a side of you, each one of you. You can sing, you can dance, you can paint, you can draw, you can do so many things. I'm sure you can do that. But there's the side that you have chosen to neglect because the mind does not allow you. But the spirit will allow you. It will encourage in fact, to get back to your hobbies. And that's me singing on the stage in front of an audience, live. And that happens because you want to express the softer side that you have. How does your spirit get food? Your mind gets food because you're feeding it every day with so much of tasks of your professional life. But how does the spirit get food? It gets food from being close to the nature. If you stay close to the nature, your trees, your skies, your clouds are going to feed you. And that's some of you, from Pune, who've come and you've walked with me in this beautiful park. And I hope you enjoyed it, because that's what happens when you meet up in morning on a park. That is your spirit life getting activated. So what is the benefit of all this knowledge that I shared with you? Nothing. It's zero. Because if you take the red pill and you still work through your mind, that's zero. But if you choose the blue pill and you want to embark living through your spirit, then what happens is you understand situations better. The patient's family, who actually ostracized me in the city and caused so much of harm to me and made me so anxious, I processed it later. It's their mind which is not in their control, which is leading them to think that a poor outcome is negligence. Now, I have nothing against them personally. They have nothing against me personally, but their mind is against me. And I know that my mind was greedy at the time. My mind was angry. My mind was jealous. So what am I complaining about? Just because from class 6 to class 10 I have come up and somebody is still in class 6, I do not need to demonize somebody at class 6. A mind's maturity is something that will not happen to all of us. If you can identify that somebody is angry at you, shouting at you, and it's just their mind, you can take pity and walk off. And that's what happens when you lead a path of the spirit. You respond, you don't react. And that's how you respond to storms. You respond to them. And a life with the spirit becomes joyous and peaceful because you have no enemy. Everybody's spirit is the same. Their minds can be against you, but that's all right. So I'll conclude with this story. Last month, I had this patient, a 75-year-old gentleman, very well-known industrialist in my city, so much so that if you just mentioned his name on the street, chances are that 5 out of 10 people would know him. And he was playing golf on a Sunday morning, and at 8 o'clock in the morning, he had acute pain, chest pain, and he was rushed to our emergency. And the cardiologist said, well, we've done the ECG, the trop, and they are negative. This is not infarction, but it's bad. So I was called, and I saw that he had in his old papers a hiatus hernia type 3, which he kept for 6 years, and he had not got it operated, despite many requests. I told him, let's get him to the CT scan. We took him to the CT scan, found he had an acute gastric volvulus. We optimized him and immediately took him up for emergency surgery. Now, this is despite the fact that on a Sunday morning, my CEO and superintendent said, are you sure you want to take this operation? I said, well, I'm acting through my spirit. Nothing is going to tell me not to. So I am decompressing the stomach, and you can now see the patchy gangrene of the stomach, right? And I'm cutting the left cruise on a safe zone with an instrument I can control well, which is the hook. And now, after dilating the hiatus, I'm now trying to bring it all down. It's not coming down. It's still difficult. I know I'm going to rupture it now, so what I do is I do a gastrotomy. And I suck the stomach, and you can see the deflation. And I want to now suck it right into the mediastinum so that now I can decompress it. I put it in the Nathanson now. And I'm going to suck out all the food that he ate for the last dinner. And I can see that the mucosa is healthy. I think many of you saw that too. And I'm trying to bring it all down, and I am now happy. But I can see that the fundus is blackish. Now I'm putting in the Puji just to be sure that I'm not having a non-straight stomach. Now I'm making a purse string suture on the gastrotomy. I want to put in a Foley's here so that I can check for leaks in the post-operative period. I didn't do a gastric resection. I spoke to the family that I can do the resection, but that would mean a big surgery. Or I could do this much. So that is just to keep it fixed anteriorly and also to use it for leak and also to feed the patient if there is no leak. And that's the anterior gastropexy. I have taken a suture in the anterior abdominal wall, and I am suturing the stomach anteriorly to the abdominal wall so that it stays straight and it doesn't go into volvulus again, it doesn't go into the mediastinum again. And I've told them, the family, that see, this patient can have a leak. And if he has a leak, I need to go back in again and resect. This is just a chance that I'm taking on a Sunday afternoon. So I've said all that, okay? So I explained that the second look is maybe required. On the day 5, sure enough, there's a mediastinal collection and a small leak at the posterior fundus close to the G junction. And I tell them, you're already prepared. So what do? I can go back in again, do a surgical resection laparoscopically, or we can take it endoscopically and radiologically. That would be the alternate options. Now, as families of patients would do in these situations, they're concerned. They want to talk to everybody around the globe, you know, in the United States, in Singapore, in India, in India's leading centers like Sir. And telephone calls keep coming from various people throughout the day. What are you doing about this guy? What are you doing about this guy? I said, nothing. I'm just sitting on him. I'm waiting for the decision. And the telephone calls keep on rising this entire day and the next day, but they're not willing for the surgery now. They have heard that there are therapies which are available, which are non-invasive. They have Googled it. They have been told. And now they're wanting to, do something non-invasively. So my hospital says, Sarfaraz, please ship this patient. We don't want this trouble anymore. My team says, we've had enough. We've had enough of these difficult people and difficult surgeries. Please let them take this patient anywhere. And we were taking audio-visual consents on a daily basis. Everything was audio-visually recorded. We were looking at the patient and the family as potential litigants already. And my team members would go in a very business tone, oh, well, now the pulse rate is this, the blood pressure is this, and he's okay, but he would need a second surgery, or he would need, so very business tone. And I ask you, the mind would definitely be cautious. Yeah, that's the job of the mind. But the spirit, when you meditate and you ask your spirit, how do you respond to this? Consider that this gentleman is your own father. How do you respond to the situation? And at that time, would you believe it, when I prayed in the morning and I asked my spirit, how do you tackle this situation? And on my laptop in the afternoon, all by itself, this poetry by Mother Teresa comes up. All by itself. And it's called the final analysis. And I want you to hear this before I leave you. People are often unreasonable, illogical, and self-centered. Forgive them anyway. If you're kind, people may accuse you of selfish, ulterior motives. Be kind anyway. If you're successful, you will win some false friends and some true friends. Succeed anyway. If you're honest and frank, people may cheat you. Be honest and frank anyway. What you spend years building, someone can destroy overnight. Build anyway. If you find serenity and happiness, they may be jealous. Be happy anyway. The good you do today, people will often forget tomorrow. Good for the surgeons, right? This is very important. The good you do today, people will often forget tomorrow. Do good anyway. Give the world your best anyway. You see, in the final analysis, it is between you and God. It was never between you and them anyway. Thank you. So that was Mother Teresa. And those of you who are uncomfortable with the word God, you can replace it with anything. Spirit, soul, subconscious. So what I did was I went back and I told her daughter, who looked like a good friend to Meg, I said, you see, Meghna, I think you and I need to talk. We are all very pressurized. I can see that you're all worried. So am I. If it was my father, I would like to give the best. And whatever you decide is fine. But I think we need to take a call. We either do a second surgery, or alternatively we do something like an endoluminal vacuum therapy, or put in a stent there. But something needs to be done. And we're just taking too much of time here, and I would be very unhappy if we lost him like this. And if you just understand my intention is just to do good. If you want, I will talk to any other center that you are taking this patient to, but we have to take a call. And I said, you take my number, WhatsApp me, ask me any number of questions, but let's just get this done. She understood. And she took the patient to another center, and I spoke to the gastrosurgeon. I spoke to him. I told him it's very important. This is what it is. And please give me a number where I can reach out to somebody, a junior, and take regular feedback of what's happening. And I told Meghna that she can call me anytime, and she can leave a WhatsApp message. And we keep on talking. The patient is still alive, but struggling for his life. How do surgeons find calm in the storm? You can't predict, you can't prevent storms, for sure. But you can meditate to discover your spirit, and you can find your calmness. And when you find your spirit and your calmness, you will actually know how to respond. And I wish that each one of you can identify the spirit in you. I am not saying because I have, I'm just saying that I try, I struggle every day to overcome my mind and to get the spirit out. Sometimes my mind is working, maybe my mind is speaking now. Sometimes my spirit is speaking. I do not know. I don't have an answer for you all. But I know this much, that if I lead my life through my spirit, despite all the external pressures and external storms that you have, it is a much peaceful and joyous life. And you know exactly what to do and how to respond. In the beautiful lines of the Sufi poet Hafiz, and this is my submission also, I can't put it better, so I'll use his words. I wish I could show you, when you're lonely or in darkness, the astonishing light of your own being. Thank you. Thank you. Thank you.